Okay, this is the video competency for MA 180 suture removal. All right, so at the beginning of this competency, the first thing that we're going to do is wash our hands and gather our equipment like we start most of our competencies. So you will go to the other room and do a surgical aseptic hand wash, and you're going to gather your equipment for this competency. The equipment that you're going to need is you'll need your patient's chart and an encounter form. You're going to need a suture removal kit, and you are responsible for wrapping your own kit prior to the procedure to make sure that it is wrapped properly. You should have a suture removal scissors, okay, suture removal scissors, a bandage forceps, and at least one, maybe two pieces of 4x4 gauze wrapped in a sterile manner. You also will need regular gloves. They do not need to be sterile gloves, just regular protective gloves, a black pen, a cotton-tipped applicator, a bandage sealed in protective wrap so it's sterile, and then also care tips for your patient's suture removal. Okay, so I have all of my items gathered. I have another suture kit here in place. So then the next thing I'm going to do once I have everything together is I'm going to call my patient in. Now for this portion, I'm going to give you a patient name, and that's the chart you're going to pull. But what we're going to have instead of your patient is just this jean leg, and that's where you're going to take your sutures out of, okay? So when you call your patient in, it'll just be me so I can watch you take out your sutures. So you'll call your patient in this case, we'll say it's Aaron Wood, so I'd say, Aaron Woods, can you come on back? I will come back with this jean leg because I'm the patient, so your patient's not going to be in there until I come in. So I'll come in with the leg, and I'll set it up on the table. Now you as the MA, you're going to ask your patient, can I have your date of birth? So I'm going to ask my patient, can I have your date of birth? And I'm going to tell you it's 4/10/2003. Okay, great. Now you're going to explain the procedure to your patient. What you're going to tell your patient is, we have some sutures that were put in, so we're going to take those out for you today. You want to ask your patient how many they had put in so that you take out the appropriate amount. So if your patient had 5 sutures put in and you only take out 3, you may need to ask your patient if a couple of them fell out on their own, or look closer at the wound to see if you're missing something. So you ask your patient, how many sutures did you have put in? Where were they put in? We're going to go ahead and take those out for you today. So you've explained to your patient what you're going to do, okay? So the next thing you're going to do then is you're going to get your equipment and get it ready behind the patient so you don't have to turn your back on your sterile field. So I have the items that I need. And then you're going to open up your suture removal kit in sterile manner. So if you remember, sterile manner is to open away from you first, then the sides, then lastly you're going to open towards you. Now I have my sterile field. On my sterile field, I'm going to drop my bandage. Now if you open these band-aids really carefully and slow, you can drop them on your sterile field without ripping it. So you're going to do the best that you can. So you're going to open it in a sterile manner, and you're going to try and drop that bandage on the center of the sterile field, right like that. Okay, the next thing that I'm going to do is I'm going to put on my gloves. Now, throughout this, I may want to ask my patient some questions like, oh, how did you do this? Does it hurt? Did you have any problems? Just to kind of fill the silence. The next thing I'm going to do is I'm going to go ahead and pick up my suture removal kit. I'm going to, and I will tell you as your instructor which sutures you're going to take out. So you may want to zoom in on this part, Emily. And what you're going to do to take out the sutures is you're going to grab it by the knot, not one of these little tails hanging off, but you're going to grab the suture by the knot and pull straight up. You're going to use the hook of the suture removal scissors, and you're going to cut. Now, if you notice, I have my scissors running the same way as the wound. You do not want to cut this way, because what can happen is you cut the top of the suture off and the bottom stays in the patient's skin, and that is not good. So you're going to come at it at that angle, hook it, and then turn. So you see how I did that? I came at it perpendicular, I hooked it, and now I'm going to cut it parallel. I'm going to cut that one suture and pull that one suture off. And then I'm going to put it on my gauze. So I see I got the whole entire suture. And you're going to repeat that. So if there's another suture that needs to be taken out, again, I'm not going to pull it by the tail. I'm not going to pull it over this way. Let me show you what happens if I do that. If I take this and I pull it this way, then the material that was out here, the suture material, now has gone under the patient's skin and can cause infection, okay? So you grab it by the knot, pull straight up, come at it, hook. Don't cut into the patient's wound. See how it's real easy to get that scissors in the wound? You don't want to do that. Barely hook close to the patient's skin. Now my scissor blades are running the same direction, running parallel with the wound. Try that again here. Okay, and then you just do a little cut. As you cut away, pull the suture out and put it on the gauze. So let's say I only needed to take 2 sutures out of this particular patient. So now what I need to do as a medical assistant is I need to inspect the wound. I want to look at the wound, make sure it's healing well, make sure there's no redness, there's no swelling, there's no drainage. For our purposes, we're just going to look at it. Yep, it looks like it's healing pretty good. Now is where you'll take your cotton-tipped applicator and you're going to clean the wound area. Okay, so you're going to clean it nice and good. Then you're going to apply your dry, sterile bandage. So this is the area I took the sutures out. I'm going to take my bandage. Now that the wound is clean, I'm going to apply that dry, sterile bandage. Okay? I'm going to take this mess and set it aside. Ask my patient how they're doing. Everything's good. So now what I want to do is I want to remove my gloves before I do anything else. Before I give my patient their care tips, because my gloves may have some blood on them from removing the sutures. So I need to remove my gloves in the proper manner. If you remember, close to your body and straight down. Grab the palm of the first glove, pull it off inside out, wad it up in the second glove. Take your ungloved hand, go along your skin, pull that second glove off inside out so that the contamination is innermost. Set that aside because I'll get rid of that. And then I'm going to talk to my patient. I'm going to tell my patient, give them care tips. These are things that you need to look for. Okay, so watch for this. You shouldn't have any problems, but if you do, there's our telephone number at the bottom. So what you're going to do is give this to your patient, and then your patient can go. Then you just have documentation. Okay, so the last thing we have left to do, my patient has been dismissed with their care tips. I just have my documentation. So my documentation is going to include doing the encounter form. So top is the same, today's date for date of service, patient's name, patient's date of birth. Office visit is for us, always going to be a 99212. I have laceration over here, that's what my patient had, that's what I treated. And then suture removal circled because that's what I did for my patient. Now my documentation in the chart is going to include making sure my patient's name and date of birth is on here, date and time. I'll say I took out 3 sutures removed from patient's right thigh, because that's what I did. The wound is intact and healing well, because then I inspected the wound. Area cleaned and dry, sterile bandage applied. That's what I did next. I took the sutures out, I checked the wound, cleaned it, and put a bandage on, and my patient tolerated well, and then I signed it.